In our previous posts on the ACL Road to Recovery series, you have been able to view various treatment options we use to help prepare an athlete to return to activity. In order to determine if the athlete is ready to advance to the next phase, we need to ensure that the athlete has mastered appropriate movement patterns during dynamic tasks and that they have built a solid foundation of strength, coordination, joint stability, and neuromuscular control. Combined with the best available data for healing time of 4 to 5 months, we implement a criterion-based approach to identify any deficits that would prevent safe return to running. First, the athlete is asked to walk at a brisk pace on the treadmill for 15 minutes as we look for any insufficiencies in the walking pattern. Common deficits include decreased stride length, hip drop, or increased movement at the knee or hip. Gait is affected by decreased quad strength. If the athlete has insufficient strength, control of the limb is compromised and they should not be progressing to run. Limb Symmetry Index, or LSI, is measured to determine quadriceps strength. In order to progress to running, the athlete must demonstrate greater than 80% strength as compared to the uninvolved limb. This is measured by 1 rep max testing during leg press or leg extension. LSI is calculated as the 1 rep max of the involved limb divided by the 1 rep max of the uninvolved. The next true criteria are measures of neuromuscular control. The athlete must perform a single leg squat to 45 degrees 10 times without any compensations. Compensations during the single leg squat are similar to one seen during gait, with the addition of abnormal trunk movements. 45 degrees is chosen because stance phase absorption occurs at this angle during running, with the knee being more flexed with running as compared to walking, requiring necessary dynamic control. The step and hold must be performed 30 times without compensation, including loss of balance or excessive movement from side to side. The step and hold simulates a lower level of running, with the athlete stepping a typical stride length onto the affected leg and then maintaining stance on that single leg. The Star Excursion Balance Test combines lower extremity strength, coordination, balance, and flexibility. This test is performed to determine dynamic postural control. It measures balance by challenging athletes to stand on one leg and reach as far as possible in 8 different directions. The Y balance test is a new and condensed version of the Star Excursion Balance Test and uses 3 of the 8 directions and is a less time-consuming option. The injured limb must be greater than 90% of the unaffected limb to meet this criteria. The test can also be used to determine if the individual is at risk for injury, resulting if greater than 4 cm difference is found between the limbs during anterior reach. If all of the criteria of these tasks are met, the patient is ready to advance to a return to running program. Alternating periods of walking and jogging are implemented with progressive increases in distance. Distance-based progressions more accurately control the load experienced at the knee joint versus time-based. The athlete should complete at least 3 sessions of running on a treadmill under supervision to make sure any deficiencies are identified and corrected before that athlete can continue to advance independently, and they may choose to run on the track or the treadmill based on their preference. Stay tuned for our next installment on the road to recovery.